Hi, everyone. Welcome and thanks for coming. My name is Eric Oyen. I'm the Director of Membership and Marketing here at ACPM. Want to welcome everyone to this resident orientation. Um, we think we have a great session lined up for you. And so we'll kick it off with a welcome from the Vice Chair of the Membership Committee, Tina Singh.
Hi, everyone. My name is Tina Singh. Eric, thank you for the introduction. Thank you all for signing in. It's really great to see that we've got quite a few people on this call. Are you guys able to hear me?
Okay. Yes.
Yes. Awesome.
Very clear.
Awesome. So yeah, I just want to say a few words before we get into this session, and then I'll introduce our first speaker that you'll hear from. But I am the vice chair of the membership committee here at ACPM. I'm a preventive medicine practitioner, graduated back in 2014 from residency. And one of my biggest passions in PrevMed is actually resident engagement and really fostering the next leaders of preventive medicine. So this type of a session is really energizing for me and is very exciting for me. First, I just wanted to thank you guys for taking out time in your day to be here. I think that residency is one of the most incredible times in your career journey as a preventive medicine resident. It's kind of the beginning of this journey that you're charting for yourself, and it is incredibly unique. It is not like what a lot of other residents in clinical specialties go through. And I think the fact that you're here and you're willing to engage with your peers and with hopefully folks that will become your mentors later on is really powerful. And so my suggestion to you all, just being here on this call, is to, one, and I will say this to anybody that's in PrevMed, but especially for you all here, keep an open mind and soak in as much knowledge as you can. You're going to hear from a few people in the beginning of this session who have built incredible careers in preventive medicine and are doing really, really amazing work. And they are folks that you're going to want to keep in your network. You're going to want to talk to them as you go through your career. You're going to want to touch base with them when you have questions about what you should do or what areas you want to pursue. So keep an open mind, try and learn as much as you can, and try your best to connect with as many people as you can. Not just in this session. We're going to have breakout rooms where you're going to get to talk to folks who are on the call, both those that have advanced in their careers and also other residents. But really try and build your network. Use this as the starting point for building that network. You are going to be surprised at how much you learn from other residents, how much you learn from people who have been there and had long careers already. And so much of what you think you may hear now that isn't necessarily relevant to your life is going to end up being relevant later on down the road. So again, I'm just really excited to have you guys here. So pleased to see such a good turnout. And without further ado, what I will do is pass it on to our next speaker, Dr. Neil Kohatsu. He is actually a past president of ACPM and currently works at the Center for Health Policy and Research at UC Davis as a health strategist. He's held a number of significant roles in his career, and he is someone that I look up to as a very successful preventive medicine physician. And I'm really glad that you all are going to be able to hear a few words from him. So Neil, I will give you the floor.
Well, thanks so much, Dr. Singh. It's a real pleasure to be here. I see staff found my college graduation picture before the invention of color film photography, but that's okay. I just want to welcome you all to Preventive Medicine and congratulate you on making a wonderful career choice. As the photo indicates, I've been around quite a while. I have a lot of friends who are doctors, and with that in mind, I think that specialists in our field are among the most enthusiastic, creative, and dedicated physicians in all of medicine. So while preventive medicine gives us the opportunity to work in a broad range of settings and addressing all kinds of health concerns, we all share a passion to make a difference for those we serve, whether they're individual patients, families, or communities. So for me, I think preventive medicine is unique because it's a specialty that allows us in many ways to define our own career path and to address health problems in innovative ways. As Dr. Singh noted in a talk at our last ACPM meeting, in preventive medicine, you truly can color outside the lines, and she'll tell you more about that at another time. So given this backdrop, I really encourage you, I echo Dr. Singh, I encourage you to deliberately explore widely in your residency. Look at those new challenges. You'll learn a ton along the way, and you may find that focus that ends up defining your career. So the last thing I want to say is remember you're not alone as you navigate within preventive medicine. Again, echoing Dr. Singh, seek out mentors, peers, colleagues as you explore, because so often these contacts can help you make that important career decision. You can bounce ideas, you can just be inspired. And of course, ACPM is here to help you build your own network of like-minded physicians. So again, congratulations on choosing a career in preventive medicine. I see really bright futures for each of you. And now I have the pleasure of introducing our next speaker, Dr. Wilnice Jasmine. Dr. Jasmine completed residency at Johns Hopkins in 2019 and recently joined the Oregon Health Authority, Oregon State Hospital, as Deputy Chief Medical Officer. Wilnice.
Hi, thank you for that introduction, Neil. And I also want to really reiterate the welcome for everyone and welcome to our medical home. So thank you again for taking the time to join us today. And one thing I want you to keep in mind is that the world of preventive medicine it's vast. So what's both exciting and can be daunting at times is figuring out how you will use this wide variety of tools at our disposal. So when you're thinking about our ability to influence policy making, and as a side note, I do recommend you be on the lookout and actually go look for opportunities to make your voice heard when it comes to policies that are calling for public comments. That's a good exercise to see and get involved in policy making. And then other tools when you're thinking about community collaboration, if you're interested in direct clinical services, if you're interested in quality improvement, or if you're working to cover populations at either the national, the state, the local level, at the level of organizations, you have a lot of flexibility in incorporating what you call like creativity and sometimes non-prescriptive or outside the box thinking in what you do in your career. And so I encourage you to reach out to your preventive medicine colleagues. Also reach out to your colleagues who are outside of preventive medicine, whose roles resonate with you, right? And talk to them about their day-to-day. At this stage, you can wear your "Hey, I'm in training" cloak. And that cloak really makes it easy for people to open up and share their journey with you. And I encourage you to be persistent and know the world in general is constantly evolving. And so there's always a need for people with your type of training to incorporate these changes of how the world's evolving into how populations are able to live a healthy life. And again, I'll repeat what Neil said. You are not alone. For me, I completed my residency in 2019, and in thinking about things I wanted to keep in mind, things I would share right now, to me when I was in training still. I would think about, I'll remind you to remain open to the possibilities and not prematurely close yourself to the opportunities that may come up, or prematurely prevent you from creating your own opportunities as they come up. Your point of view and your vantage point is very valuable. And during your rotations, meet as many people as you can and ask about how they got to where they are, what they like, what they don't like about their work, what hobbies they like or would like to start, just to help you get ideas of how to live your career life, live your personal life. And then all that creates a sense of connection. And that sense of connection is what's truly valuable during this stage. And so take the time to also know your colleagues. You both are learning the ropes, or you all are learning the ropes together. So I encourage you. And then just, again, be persistent. If someone you reach out to does not reply to you, just keep reaching out to them. Sometimes people are busy, get stuck in their own world, but their willingness to help is there. So just continue to be persistent. You're not a bother at all. And welcome again. And now I'll switch it over, or hand it over to Sylvia Caswell. So Sylvia, she recently completed her preventive medicine residency at Loma Linda University in Southern California. And during that time, she also was chief resident. So it's your turn.
Thank you so much. Can you hear me okay? I hope so. Thank you so much for the intro. I'm Sylvia Caswell, and I am very honored to be able to talk to you today. And I just wanted to congratulate you for the fact that you made it into preventive medicine. That's very exciting. And I know that for some of you, preventive medicine was a straight shot, and you knew exactly what you're doing. For some, it may have been an incidental finding, perhaps in another specialty, or maybe even after training. And so I wanted to hold out space for those, for those courses that may have been windy, like mine. So I came to, find out about preventive medicine through lifestyle medicine while I was in medical school and working on lifestyle medicine projects, and got to know that preventive medicine was a thing. And it was perfect because I was very much geared towards, prevention, and, and it was upsetting that we had such a reactive healthcare system. And I thought at the time I could go into family medicine and do a lot of prevention, which I could, but it turned out to not be the right specialty for me. So I ended up fast tracking my preventive medicine training and ended up in Southern California, where I could do a lot of lifestyle medicine, which is one of the things that I currently do right now after residency training, in addition to my primary role in public health at the county level. And I'm very excited to be able to be in that opportunity to apply what I learned in training in population medicine and also in clinical medicine with individuals. So as you know, preventive medicine is very broad spectrum, right? We get all these tools. And so it can be, maybe unclear at the very beginning of residency in PrevMed what you want to do, because there's so many options out there. And like it was mentioned, you can definitely paint outside the lines. And so that means, you can do so many things given all the tools that you will get as part of your training. And so ACPM has been very crucial as part of my journey. I started becoming involved with ACPM as a resident or as a medical student when I was in my 4th year. And it was during those conferences when I started attending them that I really started to make really, really good connections and started getting some mentorship by physicians that had the same interests as me. And I felt like conference attendance was absolutely amazing. And I highly encourage everybody to attend the conference coming up next year in April, because you can make, your network You can, get to know mentors in the areas that you're interested in. You can get engaged in our specialty and become involved in, in the committees and gain leadership opportunities, which will help you with your career placement after residency. So I highly encourage you to, reach out to people that you feel like are practicing the things that you would like to practice. And like Elise said, keep, reaching out and making those connections, because they will be very vital, when you're looking for a job, when you're close to finishing training. So that is that for me. So what we will do now is we're going to facilitate breaking up into small groups, and Eric is going to help us out with that. So we're going to have a few residents per group with a facilitator, and we're going to have about 20 minutes for this. And so each facilitator is going to, kind of guide the conversation a little bit, but the residents will get to know each other. And I highly encourage you that, I hope that you have a good time. And so just introduce yourselves briefly, what program are you in? Why did you choose preventive medicine? What was your journey like? Because not everybody's journey is the same. And it's always nice to know where other people are and how they got there. As some residents may be in very small programs, and so it's very vital that you connect with others. And then what are the things that you're passionate about professionally and outside of your career? It can be anything, you can talk about loving your puppies, what you like to do for hobbies, and then anything that you might be interested in professionally. So we're going to go ahead and break out into our groups. And I think everybody is slowly coming back in.
I did want to ask you, Dr. Caswell, if this is an okay time.
Yeah.
You said you're doing a combination of clinical and county level. Is that right?
Yeah, absolutely. Yep. I do, my full-time job is in public health. My focus is on chronic disease prevention and maternal and child health. And then my clinical role is outside of my current job right now, and it is doing lifestyle and obesity medicine through telemedicine. So it works out very well right now.
That's kind of a that's kind of a path I'm interested in, because I want to do rural medicine, and I feel like you probably have to have your foot in both given the landscape. But
yeah, so we can connect. So what we can do, we're just gonna have, now that we're having everybody coming back in, I just wanted to take a second and thank you for sharing, about yourselves with your colleagues. It's always nice to see where everybody is and what they're interested in. I love hearing everybody's paths. And as you may have noticed, a lot of people's paths are like this. Sometimes it's not straight through, and it's okay to have that experience. And please know that you're not alone. It's a very common thing in preventive medicine. Did anybody have any insights that they wanted to share with the rest of the group? All right. So what I wanted to ask you, if you are willing, I know that as you may have gathered, some people may have similar interests. And so if you would like to be able to provide your contact information, your name and your email and a couple of your professional interests in the chat, what we can do is we can save all the names and contact information for everybody, and then we can send it back out So by giving out your contact information, you're, consenting to that being distributed among the other residents, just so that way they can connect afterwards. So if you can take a couple seconds and put in your contact information if you wish to be contacted or you wish to reach out to somebody, that would be amazing. And then also try to add like what your professional interest is, so that way you're able to connect. So I'll give you guys a couple seconds to do that. And I'll go ahead and do that for myself as well, in case anybody would like to connect. Let's see. All right. This is great. Yeah, we're seeing some lifestyle medicine, obesity medicine, women's health, immigration health. Love it. Healthcare provider burnout. Big one. Absolutely. Physician advocacy. Please, everybody, advocate for yourselves. A lot of us have come from very demanding specialties, like primary care, surgery. So that's very real. And just know you're not alone with everybody. Okay, awesome. Let's see what else. Clinical informatics, love it. That is a subspecialty. Quality improvement, awesome. Preventive medicine residency, yep. We've got Veronica, who's family medicine and interested in Prev Med. A lot of lifestyle medicine. I love this so much. Look at that. Cardiology, preventive cardiology. Yep. That's amazing. Prenatal care, maternal child health, addiction medicine, obesity medicine. Love it. That is great. See, there's so much potential for connection here. There's quite a bit of refugee health as well. Love it. Global health, hepatitis C eradication. Organized medicine. Yep. Patient safety. Love it. Yep. Love all of this. Thank you so much for sharing your information, so that way we can share that with everybody else. Because that is super important for us to start making these connections now, because it's going to be so valuable for you later. So that way you don't feel like you're alone out in the world. Just know that there are others that may share a lot of similar interests with you. All right, so with that in mind, we're going to take the time and turn it over to Eric Owen. He is the Director of Membership and Marketing. And he's going to give us an overview of the general membership offerings that ACPM has for you. So take it away, Eric.
Awesome, thank you. So, like you said, I'm Eric Boyne. I am the Director of Membership and Marketing here at ACPM, and just wanted to talk real quick about what the college has to offer. The college really comes down to two things. We are here to support the profession, and we're here to support you as those who practice it. All right. And so we are here to make you successful. A little later on, you're going to hear about some of the work we're doing, and hopefully with your help to help support the profession. But here's some of the things that we can do to help support you. One of those things are volunteer opportunities and our various committees. This is a really great way to gain exposure to some really key issues. We have lots of committees, ranging from, addressing the pipeline to preventive medicine, and that's some of the folks on this call. It's the membership committee, and how to grow preventive medicine. We have committees on advocacy if you have an interest, on the political side of it. We have stuff on ethics and science and translation. So if we have something for you, if you want to get involved and really grow your skill set in these areas, and you can always reach out to us. if you have any questions about that. Additionally, we have opportunities for you to get published through American Journal of Preventive Medicine and ACPM Focus, which are some wonderful opportunities there to show your research. And then when it comes to helping you with your career, we have a career center for our members. It's a great place to find Prev Med jobs. We have networking events throughout the year, much like this one, where you can meet both peers and then real leaders in the profession. Our membership really has some really incredible doctors here, and then help you with your skills development. We offer all kinds of courses to help you in your practice. To get CME. We also have courses to help things like military and veteran medicine, for instance. So we really want to make you the best version of yourselves in your role. And I will say, if you have any questions about any of this, please reach out to us, and we're happy to talk to you about it. In addition, what's great about the college is that it really is member run. You can see on this call all of the members who are really driving this forward. And I would say our members are incredibly generous with their time, and they won't hesitate to talk to you if you have any questions. And if you're looking for someone who has area of expertise, you don't know who to talk to, please reach out to us, and we can help connect you with someone who can help answer your questions. And from here, I'm going to pass it to my colleague, Anita Vallon.
Thank you, Eric. My name is Anita Balan. I'm the Director of Residency Program Development and Engagement. I've had such a privilege of working with so many of you. I know so many of you by name and you may be familiar with me through the matching service through which you got matched into preventive medicine. Congratulations to all of you as you've begun your journey in preventive medicine. We can pretty much talk endlessly about so many opportunities that this college can provide you, but we want to be cognizant of your time, and we want you to actually enjoy the next section on how you can become an ambassador for prevention and for preventive medicine. So I'm going to be really quick here to continue with what Eric said. Obviously, one of the things that I heard in my group that the members, residents want out of the college is networking. And we have plenty of opportunities for that, especially at our signature event at the ACPM annual conference that takes place once a year. And it's going to be next year in Washington, D.C. Mark your calendars between April 17th and the 21st, including a March on the Hill on the 17th. And here's where you can also demonstrate your expertise in research and present research based on what you're already working on. The poster abstracts are due on December 4th, and the oral session abstracts are due pretty quickly on October 2nd. You probably already saw a lot of announcements about that, and more reminders will come. So this is a fantastic signature event where you'll get to connect with more than 500 to 600 members and learn from the experts in the field. So we highly recommend you to contact your program director for additional details. And we also have scholarship opportunities about which you'll get an announcement in the coming weeks. It's in my previous role here within ACPM, I've had the privilege of working with physicians and health systems within the organization and truly engaging the members to develop educational opportunities, develop toolkits, et cetera. So we have some specific opportunities coming up for our members, including developing a skill-based workshops in preventive medicine for the Preventive Medicine Annual Conference. We're going to be developing some educational opportunities for which we would like the residents to be paired with senior physicians, so that it's also a mentoring experience for them. And we also want reviewers. I've personally worked and had the privilege of working with more than a dozen residents who've reviewed CME modules and provided substantive feedback, et cetera. So there are so many different ways in which you can get engaged and showcase your expertise and build your expertise. And so So I'll leave that for now, because I'll leave it at that for now. I've also left my email in the chat at aballen@acpm.org. My iPhone is my sixth finger. I probably shouldn't share that with PrevMed physicians, because it's burnout is a key issue here. But my phone is I always respond by email. I'm always available, so feel free to reach out to us if you have any questions, and we're here to help you with your journey in whichever way we can. Eric, over to you.
Thanks, Nita. And just like to throw on the next slide here, we do have a page dedicated to residents.
Yes.
So, please check out the QR code and those resources there. And, like we said, if you have any questions, please don't hesitate to reach out to us. And from here, going to pass it along to Melissa Ferrari, the Vice President of Membership and Operations.
Great, thank you, Eric. Before I move forward with my introduction about our ambassador program, I would like to reiterate, please capture Anita's email. And one of the main reasons I share that is in my breakout session, one of the themes that really surfaced was what's after graduation? How do I take my passion, and where do I go, and what do I do, and what are my opportunities? And that is the type of questions we love to answer and love to provide resources to help answer. And Anita's going to be working on programming. And these are the types of topics that are helpful. So if there are questions as you think and look ahead at your career, please reach out to Anita. We want to make sure we're addressing your needs and helping you get the guidance and support that you need. To switch gears a little bit, I have the pleasure of talking and introducing our next program. It's our ambassador program. Quick background, and this really started in late 2020 or early 2021 when ACPM was really reflecting and thinking about how what we could do during the pandemic, what we could do as an organization, as a college, to help address the pandemic and support our members. And at the time is when the COVID vaccination, the first round of the COVID vaccinations was getting approved and coming out. And we did some research, and my statistics, I don't have the exact number, but I remember the rough estimates. We had about, at the time, about 60% of the healthcare profession had confidence in the vaccination. And our members had, it was closer to 90 to 99% confidence in the vaccination. And what that said to us was our physicians, our preventive medicine physicians, really have a voice. They really have an opportunity to speak out and to share their passion and talk about the importance of prevention and public health. And this led us to the ambassador program. And through this program, which our colleagues at BRG, you'll hear us talk about BRG Communications, they have been a fantastic partner with us in this program. And it really started out to be, we are vaccine confident, you can be too. And you can see from the map, which Maureen, I will be introducing shortly, will go into, but we really recruited ambassadors from all over the country and to really be a voice for the campaign. And what this created in the meantime was a model. We realized there's a lot of passion in our members, which we already knew, but it really became evident. And so we've translated that to other programs. We now have ambassadors who help support our HIV prevention program, Let's Stop HIV Together, in conjunction with the CDC. And then we recently launched This is Preventive Medicine, which is an awareness campaign about the specialty. And we have ambassadors who have volunteered to step up to help be champions for that campaign as well. So with that being said, I'd like to welcome Maureen Abel and Amy Burdick from BRG Communications. And they're going to talk a little bit more about the program, go into to a little more detail, and really give you the opportunity to learn how you can become involved and be a voice for the college, and more importantly, for your specialty. So Maureen?
Thank you, Melissa. So yes, so as Melissa mentioned, I'm Maureen Abel. I'm a senior director at BRG Communications, and we've had the great privilege of working with Melissa, Eric, and the whole team at ACPM on a number of communications initiatives, one of which, of course, is the ambassador program, which is really exciting to us because, like Melissa said, it really has become a model that we're starting to see other organizations follow or lean into, but really takes advantage of the just the incredible depth and breadth of knowledge and passions of ACPM members. I think when we first started the Vaccine Confident program, we had a small but mighty group of about 10 early adopters, and we have since surpassed the 100 ambassador mark. And these are our members who wanted to join the effort just kind of on their own volition and through recruitment efforts. But I want to turn it over to Amy to kind of share a little bit about the program and different ways that people have gotten involved. And then I will share a bit more about 2 of the signature programs that Melissa mentioned that our ambassadors have supported.
Thank you. Well, as Maureen mentioned, I'm Amy. I'm a senior manager with BRG Communications. And just to kick off more about our program, we wanted to share some firsthand feedback from some of our long-standing members and very active ambassadors as part of the program. So here you can really see the impact of the program and how it's really added value and enriched their membership with the ACPM. So these faces may or may not look familiar to you, but these are some of the voices that have really come through during our program. And then next we'll talk through just a few ways that you can get involved as a member, as an ambassador. So for our ambassadors, we share a wide range of materials with you, from toolkits, messages, talking points, social media content, all available to you as ambassadors to really help, bring awareness to you, your profession and your role in it, as you're speaking with different audiences. We also engage with our ambassadors through media interviews, just really helping to, share ACPM and your voice on timely topics that occur. A lot of COVID coverage that has translated now into topics such as going back to school, RSV, lots of preventive topics that ambassadors speak on in the media. Like I mentioned, social media content, we have a bi-weekly newsletter, events that are going on, templated social content for you to leverage your voice on whatever platform is your preference. And then also Doc on the Street video. Maureen will show, or we'll have a demo for that a bit later in this, but this is kind of a way for you to give your own testimonial into your experience as a preventive medicine physician, and just speak more around why you got into it, and your passions as well.
All right, so I want to talk a little bit about 2 of our signature programs. As Melissa mentioned, the We Are Vaccine Confident You Can Be Too program was kind of born out of, of course, during the COVID-19 pandemic, kind of at the height of things. The program launched in 2021, just kind of leveraging ACPM's strength to help inspire greater trust and understanding around the efficacy and safety of vaccines. But it started out and kind of became something so much bigger than that. It was really a key moment in time to showcase the depth and breadth of knowledge of preventive medicine physicians and forge touch points in local communities. And that's really where the ambassadors kind of came to play. And I think when all of this started, we weren't sure exactly how things would pan out, but it really turned out to be such an interesting and strong sort of combination of both taking the clinical expertise of ACPM members as well as sort of their personal passions, and then being able to use that to meet our audiences where they were on the ground in local communities. So for example, we had Dr. Wendy Lane, who is based out of Baltimore City, speak at a Baltimore City Council member about the importance of uptake of pediatric patients getting the COVID vaccines. We had Dr. Hunter Smith, who is a military service member, participate in a podcast recording with the Army Wife Network. We had Dr. Linda Hill out of San Diego help residents get involved with an organization called Project Tu Vida for a vaccine drive that served refugees and individuals for whom English is their second language. So it really ran the gamut, but it leveraged sort of the unique strengths and interests of the ambassadors, along with meeting a need for important audiences who may have been at a greater risk or for whom uptake of the vaccine at that time was not as high. And so the program since from that first year really blossomed and grew into a much larger narrative far beyond the pandemic, but also just about the importance of routine vaccinations and getting people back into care and back into health, with a special emphasis on pediatrics, which is where we're really focused on that work now. But we've been really proud of the tremendous coverage that this program has received thus far and continues. More than 3,000 placements in media, and that includes national and local. And the message has been seen by over 600 million people. So it has been quite an effort, and could not have been possible without the support of all the ambassadors that we've worked with. And then this is preventive medicine. So as Melissa mentioned, and we kind of we call this TIPM on our weekly calls, but the This is Preventive Medicine campaign was really driven by ACPM members and preventive medicine physicians to spark greater awareness and dialogue about the specialty itself, and not just the specialty, but just the very wide range and array of places where preventive medicine specialists operate and are able to make a difference to not just individual patients, but to entire populations. And so to do that, we actually conducted a survey of ACPM members who kind of highlighted key audiences and stakeholders, key messages that they wanted to get across, and we built an entire campaign around that, and put together this amazing resource center with tools that can help preventive medicine specialists speak to the specialty to audiences like policymakers, healthcare administrators, you name it. So a lot of that's available on the ACPM website now. And we have ambassadors who started with the Vaccine Confident program, now speaking on behalf of this campaign too. Okay. And so then the next piece we wanted to show, and Amy gave a plug for this, it's one way that that you can get involved, kind of dip a toe in, is the Doc on the Street videos. We started calling them Doc on the Street because we attended the Preventive Medicine 22 conference a couple years ago. We were on site in New Orleans. We'll have the opportunity to do so again in DC. But recorded members and visitors just sharing a little bit about their passion for the specialty and what they've gotten out of it, and kind of their hopes and goals as they go about their careers in the field. So it's very easy to record a video. We have an example to share with you actually, but if you are interested in doing that, and you already I think Eric kind of warmed you up a little bit, and the team in the breakout rooms. You can log in and you can, you'll see a teleprompter, and you can record a little quick video of yourself, just kind of sharing what brought you to the specialty and sort of what your goals are. So hopefully we can play an example from one of our resident ambassadors, Allison Yarp here. See if we can get her sound. Okay, if we're not able to play the sound, don't worry. We do have we actually do have her video, the full length version, as a link that we'd be happy to share with folks so that you can watch it. It looks like from the chat, a few people aren't able to hear it. I can see the mouse moving. It looks like someone's trying to troubleshoot, but if we need to move on to keep things moving, we're happy to share it too.
Anything? No.
Maureen, I think one of the things I'll add as our new residents consider whether this is something they want to explore is that through the process, we'll work with them to build some of their social media skills and how you can interact, work with them on some of their leadership skills, being able to speak to the media and how to develop those talking points and message points. And it's really just an opportunity to develop that arsenal of tools that really will help you as you grow your career and take it to the next phase.
Yeah, and I was going to say too, I think we've had a great opportunity to work with a lot of associations and medical societies. And one of the things that always stands out to us about ACPM is just the incredible value that the organization brings to members in terms of resources and tools and training. And I think the ambassador program, while we've seen members give so much of their time and talents and skills to help speak on behalf of these really important programs, there's also been a great deal of value added back to them as well with, Melissa, like you said, the really hands-on media training, helping to build the social media presence and just kind of taking the personal interests of each person and leaning into those so that each participant can kind of make it their own and use it to kind of create some building blocks for their career that they may not organically get in their world outside of ACPM.
And Maureen, we had a question that says, how does the training occur? Do we have to make an appointment? Do you want to talk a little bit about the process?
Sure, I'd be happy to. So we do have our ambassadors. Typically, we take in a brief form, and I can pop in our contact information too, so you can reach out. But essentially, you fill out a super short survey. We took these in on site at PM23. It takes not even 5 minutes, just a little bit about yourself and your interests. And then what we'll do is just have a brief phone call with you to learn about different ways that you might be interested in getting involved. So say you're a member of another organization with key stakeholders that you want to get in front of, or you're really active on social media, or you'd like some additional media experience. And then we kind of look to work with you to provide those opportunities. And then as they come along, so say you have a media interview request, we would work really closely with you to help prepare you, help run through questions, and kind of be there to guide you through the process. So it all kind of happens sort of organically as the opportunities arise. And then we also have specific touch points where we provide some either topic specific or kind of tactic specific training. So for example, on Monday, we'll be showcasing a variety of tools for messaging around pediatric and routine vaccinations. So it kind of happens as we go, but there are also some key moments in time where we provide some extra training.
Great. Thank you. Is there anything else you'd like to add, Maureen?
I don't think so. We'll follow up with folks with the video so you can take a look at your colleague, Dr. Yarp, and potentially record your own.
Eric, we'll send it back your way.
Thank you. So it looks like we might be wrapping things up a little early. We can give people gift of a little more time. And I think I'd like to turn it back to Tina Singh and for some closing remarks.
Thanks, Eric. Thanks, everyone. Yeah, I'm glad that we're finishing up a little early. I know everybody's really busy and it's kind of hard to tune in at the end of the day when you want to do some stuff in the evening. But first, I just wanted to say thank you again for all of you, both the speakers as well as the folks that attended. I think this was a really great session. And I wanted to kind of touch on a few things that I feel like I heard throughout the session. One, this concept of you're not alone. I know several people who spoke in the beginning said that, and I will reiterate that. I think being in preventive medicine, oftentimes you do feel alone because you're the only one in the room that's thinking a little bit differently than everyone else, or you're the only one in the room with the credentials of a preventive medicine physician. And so being part of this group, being a preventive medicine physician can feel lonely, but it can also be your superpower at the end of the day, because you're the person in the room that can spark a new idea. You're the person in the room that can tell people, let's think about this issue in a different way. Let's treat this patient or think about why this patient is suffering in a different way. And knowing that you have other people who are in your field, who are there as resources, just like all the people on this call and everyone else in ACPM, can be really empowering and can allow you to really take your seat at the table and say, I come with a different skill set that's really valuable here. So just know that if you're in positions like that, wherever you end up after residency and you start to think, I'm feeling a little bit alone here. Why am I the only person thinking this way? Know that you're not alone because you've got all of us here. Another theme that I feel like I heard a lot about was creativity. And I know a couple people sort of reference this concept of coloring outside the lines, which I talk about in a different talk of mine. But I hope that you guys saw all of the different resources and ways that you can contribute to ACPM, and that kind of sparked this concept of creativity for you. There are so many ways that you can apply many of your skill sets in creative ways within ACPM and as a preventive medicine physician. So as a resident, I said this at our last conference and I'm going to repeat it again. As a resident, you guys are in this playground space. You get to play right now because you're in training. You get to kind of explore things you may never want to do later on, but just see if that clicks with you. And because you're in this playground space, you get to be super creative without worrying, am I going to succeed in this or not? Because if you fall and you scrape your knee on the playground, it's fine. You get to just pick yourself back up and be like, okay, well, that didn't work out. Let me try something else. So I would really encourage you guys to lean in on that creative energy. Explore how you want to be creative within preventive medicine through joining some of these efforts in ACPM, like this Vaccine Ambassador Campaign program. That's a great way to say, well, I want to learn how to do public speaking a little bit better, or I want to learn how I can take this knowledge that I have and present it to audiences that are not well versed in science. All of these opportunities that we have within ACPM can really help you harness that creativity and help you figure out maybe what you want to do long term. And then the last thing I will say, which I know I started out with, was networking and how you can do that. So I know Eric mentioned that we'll have different networking events throughout the year, but I would really encourage you guys to also come to the annual conference, which is going to be in Washington, D.C. in April of 2024. It's a really great way to meet a lot of people in person who are in our field, who are doing really incredible work, and a lot of great ways to kind of partner with other people who might be interested in an idea, but they need to partner with others to kind of get it off the ground. So I feel like I've really solidified a lot of my relationships in preventive medicine by going to the conference every year. And it's also a great way to just network and get your face out there, get your name out there. And really just hear and understand what's going on in our field and keep abreast of any exciting changes. So I will wrap up with that. I really hope that you guys enjoyed this session. I enjoyed meeting those of you that were in my small group. And I'm looking forward to hopefully meeting most of you at the next ACPM conference in DC. Thanks again for attending, everyone. Have a good afternoon.